with Eli Lilly for almost 30 years, and Duane has his own business called Sellers Consulting, and he provides business software advice and training around the country for office equipment dealers. I had to read that. I had the pleasure of meeting them 2 years ago when they needed a little extra help on one of their trips to Haiti, where they've been going for about 18 years and are involved with a sister parish for St. Thomas here in West Lafayette in the town of Baudin, Haiti. And I'm going to let them tell you a little bit about that. Thank you very much.
All right.
I don't know, do I need this microphone?
Yes, you do.
Okay.
You do.
Yeah.
I'm usually kind of
Well, I am too. First of all, I want to extend a very big thank you to your group for inviting us today. My husband and I are delighted to be here. Thanks to Diane for extending that invitation. And I was thrilled to see Ellie here because Ellie is your Circle K president, and she was in Haiti with us about 10 days ago. So she just made her first trip, and so we didn't know she was in here the whole time we were in Haiti. She didn't share this, so we're kind of excited about that too. So glad to see she's here. So Duane and I, are you going to read the thing? We got. Well, this is where Baudin is, first of all. I guess I can move with this thing. So Port-au-Prince is where we fly in right here. And this is where our village is right here. And that's about distance of about 42 miles. Believe it or not, when you get in a car to drive that distance, it takes you about 3.5 to 4 hours. So once I made that drive, I don't take our potholes for granted anymore because words cannot describe how bad the roads can be. So it's kind of like driving down a dry riverbed, only worse.
We just recently experienced that in Lafayette. If you go out to Happy Hollow Park and go into the dry creek at the edge of the picnic area, that's what the roads look like.
We made that comment while we were there. So do you want me to take that? No. Okay. This is the view from what used to be our rectories, where we used to stay, and it was kind of what I always pictured when I stepped out on the front porch. We don't see that view anymore because the earthquake has had an effect on that view, but we'll go into that later. The history of St. Thomas relationship was formed in 1992 by a parishioner who went down with another parishioner, and they decided various circumstances happened that took them up to Baudin. They fell in love with it, came back, started this mission, and it's kind of done nothing but grow ever since. Initially, our funding was relegated solely to education, because without education, no one will ever get anywhere in life. Medical and dental missions then started in the late 90s. Then we introduced some water purification efforts. All of their water is obtained from various springs and wells in the area. So it kind of filters through the ground, and wherever it comes out, that's what you get. And often it's contaminated with E. coli or worms. And we saw that as a great need to improve their quality of life. So we started a water purification system. Then we started some university scholarships with the high school students. Again, working on that education theme. Then the earthquake hit in 2010 and set everything way back. So we started some efforts to work on that in 2010, 2011. We're still working on those efforts because the money is just pretty limited. In 2013, we started a seed security program, which we'll go into towards the end of the program. And then there's lots of other little programs we've had in between there that that have been very worthwhile.
Not going anywhere here.
An update there. I'll go ahead and tell you, Duane and I first started going to Haiti in the late 90s. I think I went in 1998 in the summer. I came home, I looked at Duane and I said, you have got to go with me next time. You've got to go. And that's all it took. We've been pretty much hooked on it ever since. Started going anytime we could. And primarily I work with a medical component, and Duane is primarily involved in dental, with the dental teams, but we cross over. We've both been known to cross over in those efforts, so we kind of step in where we're both needed, and that works. For the first part of the program, I'm going to start talk about our medical efforts, and then Duane's going to talk about the dental, because I think what we've done has evolved significantly, and I think it's all pretty exciting. When we first started doing the medical in the early 2000s, we had no protocols. I would go around to the doctor's offices in town and say, do you have any samples you can donate? Do you have any, what do you have that we can use? And that's pretty much how we started. Then people started giving me some donations. So with those donations, I would buy vitamins, I would buy Tylenol, because what more could people use than vitamins? That was kind of my initial thought. And those efforts just kept growing and growing and growing. We finally have a medical subcommittee at St. Tom's. We've got doctors involved. I'm not sure what. And originally there was no cooperation with our nurse down there. We just came in. We were very blind. We came in. We did what we did. We knew what we knew. And we would come home. And we wouldn't even think about, let's make this a partnership. We've got this nurse down here. We could work with her. All this took, obviously, some evolution and some thought. Most of our medical providers were nurses. And occasionally we might find a doctor. We even found a veterinarian to go with us on a trip, because that's all we had to go down. And I think after word of our teams and what we were doing spread, more and more people started coming forward. So today, our medical practices, we have written protocols in place so that anyone who comes in on trip can read those. We are trying to be as consistent as we can in how we treat.
What she's talking about a protocol, if you don't know what we're describing, is we've got a binder that describes scripting the prescriptions for a certain disease. This is what we have. This is what the doctors can count on us having. This is how we treat certain things. So we're trying to be very consistent about what we're doing, and so that any doctor or any nurse can step into the situation and know what we've done before, what we're going to do in the future, instead of a random.
And when they're seeing patients, they know exactly what medicines we have. They're all listed. We try to be as consistent as we can in that. And that's helped tremendously. We've built a team focus with a nurse down there. We try to work very hand in hand. I think that's helped us a lot. We've got a committed core team of doctors now who have joined our efforts. And really, most of our volunteers are people like you. Aside from the doctors that we have to have, the volunteers just come. They call and they say, hey, are you guys going to Haiti? I'm interested in going. What do I need to do? What do I need to know? Well, you don't need to know anything. We train you on the spot, and that's pretty much what we do. As a matter of fact, I met Ellie probably 3 months ago at a medical subcommittee team over at St. Tom's, and we were talking about the upcoming trip, and she said, she made some comment about the trip, and I said, well, do you want to go? And she went, yeah, I think I do. What do I need? And I said, well, you need about $1,000 and a willingness to do this. And she goes, I'm in. And boom, that's how fast she made up her mind on the decision. So Our volunteers come from all over, and we rarely have to even go out looking anymore. People just call and say they want to go, so that's great. We make 2 medical trips a year. One is always in February, and the other one is usually in the July-August timeframe. Those are scheduled based around the doctor's vacation schedule. So we let them choose the dates, and everybody else kind of fills in from there. What do we typically treat on a visit? Hypertension is probably the largest issue in the Haitian population. I'm sure most of you know the results of having that and not treating it. We see a lot of people down there who have had strokes. We have people who come into the clinic with like 230 over 140 blood pressures, untreated, and they live that way every day. So that's one thing we're really trying to work on treating consistently, day after day, and we've had some issues with that, but we'll talk about that in a minute. Infections and wound care are a big thing that we do. Malnutrition, scabies and worms. Scabies are these little insects that get under your skin, and they itch so bad you can't stand it. And kids scratch them, they get infected, and once they get in the house, everybody in the house gets them. So that's a real uncomfortable things. Worms from the water, generally speaking. Reflux disease, I don't know if that's endemic in the population, but almost every adult that comes in complains of acid stomach. It could be diet, it could be a lot of things. They have so many worries from day to day as how they're going to feed their kids at night. Their worries are huge. They're not the same worries we carry day to day with our jobs, but they're very large issues. Arthritis, pain issues, and the everyday issues that you and I might have that we go to the doctor for. And if we see a patient that has in particular maybe a tumor or something we can't treat, heart condition, we take them into Port-au-Prince. If it's pretty serious, we've been known to bring that information back to the States and see if we can find treatment for that person here. Our typical clinic setting is in a church. When we go down, lately our core team is stationed in Baudin, and then our priest down there has a series of villages around the area that he has to service as well. And those are anywhere from an hour, 45 minutes to an hour's drive away. Those patients used to have to walk into Baudin to get treated. It may often take a half a day just to walk there. Since we got a vehicle down there now, we try to drive out to see those patients. So we work one day in the central location, and then the other 4 days we travel around to the outlying clinics. And this happens to be in a church, and we just set up wherever we can find space. This is one of our committed doctors from Indianapolis who's started coming right after the earthquake, so he's been coming back with us every year since then. You may know this fellow here, Dr. Mike Lockwood. He's a local physician. He's giving a little kindergarten student just a wellness check. We saw the kindergartners at one time that day. Just some of our more memorable patients. This is Marie on the left in the green shirt. Marie was about 10 years old when we found her. She would stand like this all the time because this is how she could breathe. She had a very serious heart condition. It was called tetralogy of flow, if any of you were doctors. Basically, the plumbing in her heart was all screwed up, and she couldn't get the oxygen she needed. So if she squatted down, all the oxygen came up here so she could breathe normally. An Indianapolis physician went with us. She was so taken by this little girl, she got her to the United States. She came without her parents. She knew no English. She knew nothing. Can you imagine at 10 years old, getting on an airplane no less, and coming and undergoing about 8 hours of open heart surgery? She's alive and well today thanks to Dr. Tish. And we just had a 10-year echo done, and she's doing great. We brought the results back. And every year she comes to see us to so we can, you know, assure her that she's doing great. This is another one. This is little baby Mark. Tore my heart apart.
Now,
He was so malnourished when he came in.
to give you some scale, the diaper that Mark's got on is actually a mask,
A doctor's mask.
doctor's mask, an examination mask. So
And
that gives you economy of scale.
He was about 6 months old, I think, when he was brought in. We put him in the car. One of the members of the team went down to a nearby city called Jacmel. And we got him admitted to, Mother Teresa has an organization. She's got a group of nuns, and they have various hospitals and centers around the country. And this one in Jacmel treated malnourished kids. And then this is Mark 6 months later on the right. Mom brought him back to see us. So he had, he was not up to normal weight, but he was doing significantly better. These are some of the people you never forget. This is little Mickerlange. Mickerlange was about 10 years old also. She went down to get some water for her mother. And they have to go down to a stream to get the water. And she just cut her leg, very innocently cut her leg. And had we not been there at the time we were there, had she not come in, I think 6 hours later she would have been dead today. Huge fever when she came in. Her entire leg was swollen from infection clear up into her genitalia. And the swelling was up into her abdomen. Just, her leg was enormous. I can't believe she lived. We brought her back with us. We took her back into the girls' dormitory where we stayed with the group. She slept with the group for the rest of the trip. And we had her on constant IVs and antibiotics. And she was taken home on a donkey, and she's alive today, thanks to the group that was down there. So this little baby, this was about a year and a half ago, came in. We think he had cerebral palsy. You know, these are the circumstances where you say to mom and dad, I'm sorry, we don't know why. There's nothing we can do. And this doc had 3 kids of his own, and he couldn't put the baby down. He was so distraught, and he had to tell mom, your child is not going to get any better. This man came in and had this, that's his hip. He had this enormous growth on his hip. I'm not even sure how he got his pants on every day. And we drained and drained and drained that. We've seen about 3 or 4 of those over the years. I'm not sure what causes them. But they live with these things day after day. So
we just saw him 10 days ago, and he's not walking very well. He still has back pain, but he doesn't look like that.
I'm sure the infection got into the bone and just, chewed away at that. But, at least this growth was gone. This woman, Diane, you probably recognize her. I'm sure you do. And Ellie, yeah, she lives in a nearby village. I don't think I realized this till this past trip. She's got epilepsy. And she has a history. Every time we come to the village, for years now, she has these burns or unexplained injuries. And you're like, what happened to her? She had fallen into her fire while she was cooking. Just fell into the charcoal fire. They cook with charcoal on the ground. And her leg was so scarred, she had burned a muscle so bad, she could not, in the right picture you could see her. She couldn't straighten her leg. Her leg was permanently bent. And we have a man named Frederick down in the village. He's the local first aid provider, basically. And we leave him money every time we come to follow up on patients like this woman. And we taught him how to do physical therapy, how to teach her to work on stretching that leg out, because the muscle had, from the injury and her not using it, it had, permanently shrunk. And so he taught her how to get her leg straightened out again. But every time we come, same thing. And we finally found out on this trip she has epilepsy. That's why she keeps falling. That's why she keeps falling into the fire. Last year, Her whole arm was burned. This year, she had her elbow almost ripped off. She just keeps, you know, passing out. So, and I think this is probably the last picture. This little girl, I'm not sure if you guys can really see the contusion, the indention on her head right there. She came in February, and Mom brought her in every day to clean her. She'd gotten caught between a fight with her parents, and the dad had thrown a rocket bomb and hit the baby. And she was 3 years old, and just, you could see her scalp, you could see, they worked on her for days. Every day in the clinic, they worked on her. And Mom brought her back to say she's doing fine. I had no doubt she would have died as well, but Mom said she seems to be fairly normal. She's always going to look this way, but these are just some of the more memorable stories over the years that, you know, people say, why do you go back? Well, it's kind of easy. This woman we saw on the way back, Ellie was in the room with this gal. We believe she'd had a stroke. And the people where we were running the clinic said, on your way back, can you please stop and see my mother? And she's laying on the floor here. Oh, these little triplets were just born. We saw them for the first time last year, and they were brought in for a wellness check. So that's something you don't see down there. You don't see very often twins or triplets. Oh, I thought that was all right. And Wisner was one of our first patients ever. Wisner fell out of a tree one morning about 6 or 7 in the morning. Before we even opened the clinic, his parents brought him, unconscious, carried him in. He had a flap right here on the back of his head, about this big. And if you pull that flap back, you can see his scalp. He had fallen out of a tree. And he was unconscious all day.
And convulsing.
And convulsing all day. Just seizure after seizure after seizure. What do? You know, and you don't have that medication. Someone happened to have a Dilantin in their purse, or in their own personal stash. They just brought some medications down. We took a, you know, the little lip gloss, lip stuff, you know, sunscreen things. And when we had film containers, those gray film containers, took one of the lip things, crushed up the Dilantin, put a little saline solution in there, and gave the kid a shot because we had nothing else to do. It stopped his seizures, but he didn't wake up all day. And the priest came in and gave him last rites. We expected that he wasn't going to make it. One of our interpreters knew the family and said, please, please, can you take him into Port-au-Prince? I know this family. They're good people. Can you please take him in? Well, he withstood that 4-hour drive, you know, on those roads like this with that head injury. And the doctor carried him in his lap all the way into Port-au-Prince. Well, same diff. And we dropped him off, and he told the doctor what treatment he had given him, and he said, you've done everything you can. The rest is in God's hands. And we went back a few days later when we were coming back into Port-au-Prince. We drove past the hospital. We stopped in to see this young boy, and he was sitting up in bed. So he's one of our first great stories. And this is just a view of the countryside. It's once you go, once you see these people, once you see their joy, experience this life, it's easy to see why we keep going back. So, and our major, this is my last, our major goal for the future medically is to hire a nurse from the area and have her do rotating blood pressure clinics once a month. Go to each of the villages we service. Check the blood pressures before they run out of medication and adjust if necessary. And we're trying to get this program off the ground. We feel it's one of the most essential things we can do. But it's really hard to find someone that has that love and that willingness to do that, because traveling between those is not an easy journey.
We had this program up and running up until the nun that was running it got reassigned and moved to a different area. So it's a reinvention, and like most things in Haiti, you take one step forward, 2 steps back, 3 steps forward, a step back, and it's constant evolution. This program we feel is a very valuable thing, and we want to reinstitute it. But we don't want to just throw a bunch of money at the wrong person. So that's why we're trying to tread lightly and figure out the best path forward again. So I'm going to breeze through my portion pretty quickly.
I'm sorry I took too long.
I started going down. I crashed into Haiti with my wife in, what do we say, 99, 98?
99, 90,
And didn't know what I was going to do. At breakfast the first morning, Dave Schubert from Chicago stood up. He's a dentist and said, we need a volunteer in the dental clinic. And I went, okay, sure, I'm here. And that was really all it took for me. I'd been working out of his clinic for the entire time, basically, that I've been down there, other than miscellaneous trips that I do other things. We started with, basically Dave came into the country with his daughter who had gone to Purdue, or gone on one of the Purdue trips, and with a handful of instruments and some flashlights and some gauze. He said, I don't know what I'm going to do, but I'm here to do it. Show me the way, God. And it's been an evolution from that point forward. We started with working out of people's homes. Anybody who the priest could find to evacuate their home for a week, we would move into their house and kind of put together a clinic. And started with lawn chairs and rocking chairs on rocks and any place we could put a patient. We used that lawn chair for, I don't know, 10, 12 years. 2005, Dave got together some funds, and the priest at the time built our dental clinic on property.
If you just
Hold that?
yes,
Okay.
you're studying.
Okay. And this is the first iteration of the clinic. It's changed many times since that time. But like I said, it's an evolution. Current state of the clinic, we have 2 operatory rooms. We have 6 fully functional dental chairs, so we can accommodate 6 dentists if we choose to. Our most to date is 5 dentists and a suture tech. We often have hygienists come down. They're on their own cleaning area. Functional bathroom, that's a biggie. It's a real luxury. We have permanent dental units. We've got our own generator. We've got our own portable x-ray machine. So we're very functional as a modern dental clinic in Haiti. This is what one of the rooms looks like. You'll see on the wall what we call a dental unit, which is the drills and the irrigation. We have suction units. We have modern chairs. It's a mishmash of equipment because we begged, borrowed, and almost stole a lot of it. Here's an early iteration of our sterilization room. We hire and have trained a Haitian that we got to know. His name is Wilbert. Works with us every time we come down. He does all our sterilization for us. So Dave and I can just hand him the trays, and he takes care of getting everything cleaned up and ready to rock and roll.
And it's a job for him, so it's a chance for him to earn some money, which is great.
Yeah.
We try to hire as many, both in the medical and in the dental and in all the other projects. We try to hire as many Haitians as we possibly can to fill roles because, like Jane said, it's a source of income, and it's a consistent source of income.
And it's a teaching opportunity.
There's just another view of it, slightly updated. We have a better sterilization unit. The other one, we've got this guy here, so we've upgraded to a nice modern autoclave. It's another. This would be a stations set up for fillings, where we've got we've got amalgams set up, and this station would, we've got a dentist that comes down at least once a year and does nothing but fillings. Most of our dental work down in Haiti is extractions. We do quite a few fillings and cleanings. Our name of our clinic is Grâce à Dieu, by the grace of God, painted by a volunteer. So what do? Extractions. With two dentists, we'll go down for a week. We will see about 250 patients. We will extract about 550 teeth in that week's period of time. We'll do tumor removals, which we do quite often. We don't do root canals very often, but we are capable of doing root canals if we need to. Cleanings and restorations. We're getting more and more people wanting cleanings, which is great. We also do dental hygiene classes. Before a patient ever moves into the clinic, out on the front porch, we've got a Haitian that we've hired to show them how to brush their teeth. We give them a package of picks on a handle. We show them how to do dental, picking instead of flossing. We found out that they don't understand flossing very well, but they can use a toothpick very well. It's a skill. Flossing is a skill. Taught and not used very much in the United States even. Haiti is used even less. So we found that that works much better. They get that training before they move into the dental chair. This is an extreme abscess, and we see this every couple trips. This is an abscess that's gone so bad that it's actually eaten through the lower mandible and is starting to drain out the bottom side of their jaw. So can you imagine how painful that would be? And that's very recoverable. We treat a lot of that. Typical setup in a dentist at work. That would be a typical patient's mouth. One of our newest projects. Okay, do we have? How are we doing on time?
3 minutes.
Yeah, you get one.
Okay. Blow through this real quick. Our newest active project is seed security. We're working on new crop varieties, new storage methods down there. We've actually brought a bunch of PICS bags down. What a PICS bag is this. And it was developed at Purdue, funded at Purdue, used heavily in Africa right now. We're introducing it into Baudin as a storage method. Allows seeds to be stored and grains to be stored, and it's impervious to rodents and it's impervious to molds and insects. We mentioned earlier the earthquake. Our area was highly, highly affected by the earthquake. Almost everything in the village was destroyed. That was the rectory, where the priest's house. It's where we used to stay. Obviously, we don't stay there anymore. That's the backside of the rectory. Believe it or not, nobody was injured in our village. We lost several people that were not in the village, that were in Fort Prince. That's a school. This building used to be lined up with that building, and that used to be at this level right there. There's a first floor underneath that. So that was a school that in the village that is no longer there.
And it hit right after school was let out, thankfully.
Yeah.
So
Timing was wonderful. This was temporary classroom after the earthquake out in the middle of the schoolyard. We're still attending church in this temporary structure here, which is nothing more than that's out in front of the rectory and out into the courtyard.
it's just a tin roof outside set up on poles, basically.
Yeah. And that's the end of the presentation.
Sorry we took so long. I'm sure there's probably some questions, so.
Chuck? We have some friends, Dr. Sue Green, a dentistry team that
Yes,
just goes outside Port-au-Prince, and so they've been doing that for about 10 years. And
Yep.
so
I've met Sue, great woman. Yeah, absolutely. There's a lot of people doing a lot of work in a lot of areas of this world, and we're just a really small part of that effort. So.
Thank you for your presentation and thank you for your dedication.